All right. In May here at Revival Health, it is all about moms and celebrating moms, whether it be postpartum, if they're pregnant right now, or they have goals to be pregnant soon. Like, how can we just be able to serve mom best? And we brought in some really cool experts to be able to share what they do and how they best serve moms. And again, it's this idea of a team and a team approach to really serve mom and see them hit their goals and aspirations. So I want to bring it back to what I focus in on with chiropractic and pregnancy, and how we get the results that we do, and why it is so powerful for pregnant moms to be getting adjusted and to maintain that for them too. So I'm Dr. Drew Blennis. My wife and I own Revival Health Center in Clive, Iowa. I am a member of ICPA, which is the International Chiropractic Pediatric Association, and I am WEBSTER certified, meaning that WEBSTER is a technique or approach to be able to, in chiropractic terms, be able to best serve mom. It's how you're looking at the ligaments and the design of your adjustments and your technique to really bring everything together and serve them to the most optimum. And we're going to dig into that approach and the why and the how here shortly within this webinar. And our common goal here for pregnant moms is really just being able to optimize labor, delivery, and pregnancy in general. Really being able to realize that, like, I actually deserve to feel well through that, right? And as mom is doing well, that is better for positioning of the baby, helps baby come out with less stress, and just overall continue to hit our goals then too. So our goal is simply to be able to optimize the pregnancy, the labor, and then even postpartum too. Is it safe? I think is a really common thing, and people don't understand it or don't quite get what we're doing often will say, like, I don't know, and they'll be able to almost put a label on it as it's the adjustments aren't safe, or they're not sought out for pregnant moms, when in reality it is phenomenal for helping with pains. We're going to go over some of the benefits, but just the pain of going through pregnancy and not having to be in pain, increase labor or decrease labor times, increase labor, overall the well-being through that then too. So we're going to go dig in a little bit more on what this actually looks like, and be able to kind of maybe quell some of the misnomers on what people feel or may have heard about chiropractic through pregnancy, and be able to answer some more questions on that then too. So 5 benefits of prenatal chiropractic care. We can probably do a list of dozens and dozens, but we want to really focus on 5 here, back it up with some research, and be as specific as possible then too. Number 1, aches and pains. I think so often people just attach being in pain, not feeling well with being pregnant. And it's like, what if you can actually optimize that and feel well through that? And one thing that people assume in a way is just that, like, I'm bound to have XYZ pain. And while, that's not this thing that has to happen, we can actually really approach that in a healthy way. So there are changes that happen during pregnancy, and it's not, yes, your belly is growing, the mom's belly is growing, but also there's some endocrinological changes. Endocrinological means like hormones changing. There's actually a hormone that kicks in called relaxin, and it's simply that it helps to relax the ligaments around the pelvis. And as you can see here on the drawing, the round ligament, which attaches to the uterus and to your pelvis or your hip bones, and your body is literally adapting and trying to change to best suit the baby that's growing there too. So one of the really common things is just being able to help mom not have so much pain through pregnancy, and even be able to help get that ready, or as ready as possible, for labor and delivery then too. How does this actually happen? As everything's changing, every ligament attaches to a bone. So with chiropractic, what we're doing is we're actually getting alignment better, helping the ligaments not be so stressed out, not be so stretched, and really be able to see them optimize their movement and not take on so much of the stress of the changing and the adaptation. You think about there's a round ligament, which again, it attaches like from the belly down to the hips on each side. There are, however, a plethora of ligaments on the backside of our hips, from the tailbone to the hip to the lower back, that are all changing and adapting to a growing belly and a growing baby, right? So as we are experiencing that stress and that tension that's happening, getting an adjustment will be able to actually decrease that tension, improve pain, or see pain start to go away, and really be able to see that improve. And what I see so often is that we tend to, oftentimes someone will wait till second or third trimester. It's kind of like that last ditch, like, oh my gosh, I've been in so much pain. I didn't quite know how this could help. And what we see so commonly is, as you're seeking chiropractic care throughout pregnancy, you're actually helping to set the stage for that second and third trimester, rather than trying to have all this adaptation happening at once, right? And so a couple more pictures here. So as I was saying, there's multiple ligaments that are involved here. Here's the uterosacral ligament, basically the attaching to the uterus and to the sacrum. So all this is adapting and changing along with pregnancy. And so you think about, and it says here, if one hip rocks back into misalignment. So as I walk, let's say here's my tailbone and then my hip is here. It's called nutation, where every time I'm walking and they are gliding with each other too, as those ligaments are changing, and again, I'm going to use the word adapting in a positive way, as they are adapting to the growth and the changes happening, they carry on that stress, and what should be a glide to both sides is now causing extra stress, extra tension, and now mom is walking abnormally, and we're putting pressure to one side more than the other, or whatever else it'll be. As we keep that in the best alignment, keep it moving well, the ability for your body to be able to adapt to that helps out much more. And what I see so commonly is we tend to look at things in a vacuum, in a way, like do this one thing, like seek this one treatment for this one thing. And in reality, like all these ligaments communicate with each other in a way, right? So when we have tension on maybe around my tailbone, oftentimes our round ligament can feel that as well, and vice versa. So if we're really trying to get this adaptation to go as best as possible, we're seeing everything move well in conjunction with each other, and not carrying too much tension on the front side of my body or on the back side, and really see everything move as it's intended, right? Number 2, optimal fetal positioning. Now, this is where I take a step back and say that these getting adjustments or care throughout pregnancy is, that's not necessarily about the growing baby per se. And as you're checking on ligaments or the low back, there's a maneuver called Leopold maneuver that they use in the hospital to help with positioning. Think about WEBSTER as more as helping these ligaments round out into the proper alignment to help with positioning of the baby, right? So it's not something that is an adjustment to the belly. And I don't want people to think that way, but it's helping everything that attaches to the uterus and attaching to the growing belly, to the low back, that is adapting then too. And if my pelvis is misaligned, so my pelvis is my hips, my tailbone. So if my, this is showing up here properly, but if I should be even as possible, I'll bring it to the side. If I should be even as possible, and I am walking around with the pelvis that is situated like this, and the baby is here, is that much tougher for them to have the optimal positioning. So as you're getting adjusted, and I have unevenness in my hips, and I'm going to say in general, and uneven could be up and down. It could be a twisting or a rotation here. It's that much tougher for positioning to happening. I always take a step back and say, your body is designed so incredibly smart. It's trying to do the right thing, right? It's trying to adapt. And if my hips are out of alignment and my tailbone, however way you want to look at that, your body's going to respond by not having the baby in the position that's ready for that, as to not put extra stress on mom and baby. So as we get into better alignment there, it helps to actually optimize the fetal positioning so that they're in their proper spot. They are ready to descend down, and as the picture shows here, head down positioning, rather than carrying the extra stress on mom and baby that they're in the wrong, I don't want to say the wrong spot, but the non-optimal spot. With that being said, that sometimes happens in one adjustment, but sometimes it takes the ability for the ligaments to adapt and respond over time then to when I was in school. So a lot of my electives through school, in chiropractic school, was about seeking kids, or seeking care for kids and for pregnant moms. And I just recall sitting in lecture one time, and we had a really, really great pediatrics instructor, and he was describing how you sometimes have to brace mom after the adjustment, especially if they've been having a lot of round ligament tension, or the ligaments on the backside of like the tailbone and the hips there, that almost might feel like a rumble, like your body's literally adapting and changing. And it's not a contraction, or it's not, you know, like labor starting. It's more so that your body actually is resituated and the pelvis is aligning with that. And all of a sudden you can see that fetal positioning happening and improving then too. So again, it can be something where it changes within one or even a couple adjustments, but what we tend to see that's best is as we have the ligaments in alignment throughout pregnancy, or at least close to optimal as possible, it helps to not carry that stress and have the lack of optimal positioning for the fetus. The fetus is growing too. So again, taking care of it through pregnancy helps to see that improve that much more. And this is actually just research that was done 2016, it looks like. And I'm just going to go right to the conclusion. Spinal manipulation and adjustment of pregnant women in their second trimester increased the levator hiatal area at rest, and thus appears to relax the pelvic floor muscles. This is crucial. So if you think about the idea of tension versus strain, a body that is in a overall stressed out mode, so to speak, is not able to get to that rest and digest, or rest and start labor approach. And so what we tend to see is, as we have the muscles and the ligaments that all attach throughout the pelvic floor and the pelvis in general, if they're really tightened up and they're really stressed out, they're going to send that message back to the brain saying, hey, we're not ready, we're not optimized. As people are getting as women are getting adjusted and they're seeing these improvements change and adapt, your body's able to relax more. We go from the sympathetic fight or flight, my foot's on the gas pedal thought process or conversation, to more of the parasympathetic rest and digest. I can put the brake on, I can actually relax. Like I said earlier, there's a hormone called relaxin, and it does just that. But if the relaxin is off and we aren't able to take the stress off of our nervous system, our body won't be able to adapt nearly as well. I'm just going to read this to showcase what we actually do. The Webster technique is a specific chiropractic analysis and adjustment which enables chiropractors to establish balance in a pregnant woman's pelvis and reduce undue stress on her uterus and supporting ligaments. Again, what the focus is on Webster is getting proper motion and movement for the bones and ligaments and the muscles around the pelvis, and not so much trying to say that it is taking on too much of that stress over time. Then too, the balanced state in the pelvis has been clinically shown to allow for optimal fetal positioning. And this goes back to, again, if I should be even, or and I'm like this, or have a big rotation here, it's that much tougher for the positioning to be where we want it to be. With the balanced pelvis, babies have a greater chance of moving in the correct position for birth. And the crisis and worry associated with breech and posterior presentation may be avoided altogether. Again, it's all about optimizing. This is just one of those things, again, going back to research, people love to say, okay, what's the research behind it? An 82% success rate of babies turning vertex, aka head down, when a chiropractor uses the Webster technique. Further, the results from the study suggest that it may be beneficial to perform the Webster technique as soon as the 8th month of pregnancy when a woman has a breech position. Again, this is one of those things where we've had those calls. It's the woman's at 36, 37 weeks, and the baby's in, not in optimal positioning, and they're having a lot of low back stress. They have a lot of low back pain, and they're kind of hoping for that, like, it's the 4th quarter. Then when they hit that last second shot, and or Hail Mary in football, however way you want to look at that. And what I tend to see is, as we progress through pregnancy, carrying that stress well. Because I say stress in a general sense, there's good stress and there's bad stress. And as I carry that stress of the adaptations well, I'm better sought out for the 2nd and 3rd trimester to be moving optimally. If I'm taking all the stress of what I had even being pregnant into the 1st trimester, and then into the 2nd, and then the 3rd, is like, oh my gosh, I gotta try and change all of this, is that much more efforting for everyone there. Not that it's impossible. Like we love being able to help out that 35, 36 plus week range. But what I do know is we set the stage really well leading up to it. It helps that much more to get that improved for like I said, the end of the 3rd trimester, mid-3rd trimester then. Another just research, the survey, this is going back to the 82%. The surveyed doctors reported a high rate of success, 82%, in relieving musculoskeletal causes of intrauterine constraint using the WEBSTER technique. Now, that's not only saying 82% of improvement from someone who has pain, but that's from just, I would say, even higher success rate, people that were seeking care throughout their pregnancy or even prior to pregnancy, right? So as we have this high success rate, is these ligaments are able to adapt and they're able to respond well. Mom is moving with less pain. We're sleeping better. The mom is sleeping better. They're able to focus more. They're able to not be in such an overly sympathetic, again, that fight or flight stage of stress. This is something that we go over a lot, and it's as I talked earlier about, like a team approach. It's a multi-level reason as to why we see such good results with WEBSTER. And so number 3 is safer, easier birth. The power, the passage, and the passenger. And all of this has a effect on pregnancy and labor as well then too. So let's go over power first. As we say often, as people get adjusted, your power is on, your nervous system is healing and functioning and is doing the proper thing. If we have inadequate nerve function, we're not going to be able to send the right messages down to the pelvis saying, hey, or messages back up to the brain saying, hey, I'm on level here, I'm imbalanced here, and that line of communication gets off. So with chiropractic adjustments and seeking chiropractic care, it reduces the interference to the nervous system and allowing for greater physiological function and performance. We talk so often here in our office about like getting to the root cause, seeing your body improve overall from thinking inside out. And really that starts with your nervous system, right? If that is not functioning properly, we can do all these other fancy, cool, and exciting things. But if our nervous system is not functioning and it has that interference, that stress from the brain down or the body back to the brain, it's that much tougher to be able to adapt to all the stresses that are coming along. Passage, unbalanced misaligned pelvic bones. This goes back to, are my hips imbalanced? Are they off? And again, we often think of it like it has to be this huge, like right to left, or one leg is shorter or taller than the other. But what I see so often is just the maladaptation from the left side to the right side, adapting to the growth of pregnancy, right? So as we have the misalignment there, as my bones shift, my ligaments now don't work or move as well at that side, and I'm going to carry that stress as the weeks go along. It's that much tougher to try and reverse that. So again, the adjustment, simply put, is creating balance between the pelvic bones, the muscles, and the ligaments in that area. And then passenger. So we got power, passage, and then passenger. Optimal or suboptimal but baby positioning. And if the pelvic floor is off and carrying this, I don't want to say off, but it's carrying too much stress, it's going to be that much tougher for the positioning to be correct for the baby. So again, as we balance the pelvis, it helps with baby positioning then overall. Again, that approach of just trying to create ease and relax tension to help everything align properly, rather than trying to think, oh my gosh, how do I reorient the baby positioning? Like our big goal and our intention is allow the nerves to flow out and do their job, allow the ligaments to be where they're supposed to be and move how they're supposed to move, and allow everything to balance out and settle from then, so to speak. Postpartum, I think so often we are so focused on pregnancy and labor that we kind of forget that there's a whole nother healing process too. And for mom, right, everything's adapting. They're trying to figure out this baby and what do they need, and also being able to serve mom throughout postpartum as well. So as I have less tension post-labor in my the ligaments of my spine, the round ligament and everything like that, are able to actually help repair the pelvic floor, see the ligaments get back to where they were supposed to be prior to growing a baby, and really be able to adapt better as your body is again changing again. We're so focused on like, what do I do during pregnancy and during labor, which is all really important, but we want to make sure that mom's body can be adapting then postpartum as well. SI joint dysfunction, this is a big one too. So my SI is where my S is sacrum, which is your tailbone, and I is iliac. ilium, the back part of your hip. So again, thinking about that nutation, the word for how our tailbone and our hip moves. Here's my tailbone here, and then my hip is like this. I should walk all day and they move together. Maybe I should go more like that. They should move and work in conjunction. As those are experiencing stress and they have interference, they're not able to adapt as well. Postpartum, then, and you think about all these ligaments that are now changing and adapting. The relaxin has stopped, so to speak. Your body is now trying to get back to pre-carrying a baby. And as I have that dysfunction, it's that much tougher for my hips to move well and or not be able to have that pain then too, so to speak. Again, we talk about alignment. I don't want to belabor that too much, but again, as we fix or figure out the root cause with my alignment, my nervous system, everything else can then follow from that. One thing that we tend to go over is just helping people realize the power and the benefit of chiropractic, and research goes to show this as you're getting adjusted, it's helping not just from a physiological standpoint, but it's actually helping from a hormone and a lymphatic and all these other systems that are in play. Right, we think about our nervous system is so powerful, so profound, from my brain down the spinal cord, out the nerves, telling my body how to, all about the cell tissues and organs in my body how to function. And as you're getting adjusted, you're able to actually see your body respond better with that. Your nervous system respond and adapt to what's happening. So that that same system that is going out and telling my lungs to breathe is also helping my immune system function. Right, and as we, so it says right here, chiropractic adjustment unleashes your body's innate ability to heal itself. And as we harbor stress, often relating to your spine and how we're carrying our stress, it greatly affects your nervous system, which then affects so many other foundational things to our health. If we aren't able to properly get this message being sent out from my brain, spinal cord, out through the nerves, telling everything how to function, it's that much tougher to really be able to respond well and see your body take on things, right? We want to think about, like, we're building up the strength, the tenacity to take on life stressors and not always just fold and take things on. So with that being said, just a quick recap. We see women of all different times throughout their pregnancy. We do often get that call or text saying, hey, I heard from a friend of a friend, or my pediatrician, or my OBGYN, or whoever else is that chiropractic can help with the alignment of the bones to help with the pregnancy. We love those calls. We're really welcome to help out with that. But also too, if you're like, hey, I don't want to be in the best alignment leading up to pregnancy or throughout pregnancy, or you're postpartum and you're just like, man, I just feel like I'm just carrying this extra stress. This is for you. So we want to be able to offer a gift of health for you and the baby. And your first visit would include a full consultation to discover like what actually your health history and really your goals. Everyone's goal is unique. Yes, people don't want to be in pain or whatever else, but there's so many different things based on what your actual goals are. We want to meet your goals and help you get to that. We'll do an exam, and this will actually cover your first chiropractic adjustment as well too. Typically that's $75 for this initial appointment, and we're going to do that for $55 from this appointment. So best ways to follow up. You can text us 515-895-1400. Text the word pregnancy or pregnant to that number, and you'll receive a special discount there on that initial appointment. You can email us, info@revivalhealthdsm.com. Again, you can call, most people like to text, you can call that 515-895-1400 number. You can send us a DM on Instagram. Multiple ways to be able to follow up with us, but just know that like there are things that you can be doing to prep for pregnancy, during pregnancy, and postpartum to really be able to hit your optimal goals. And I say it so often, I really believe people deserve to be healthy. They don't have to be in pain. You don't have to deal with the things that just kind of become commonplace or the, I hate to say it, like the norm. Like, it's not always normal to feel all these other symptoms that go along with what we're experiencing through life too. So if that is something that you're interested in, give us reach out to us, give us a call or a text, and we are happy to follow up and be able to save you money on this, and also really get you at your best for during pregnancy or after then too. And here's just some of the contact info, how you can reach out to us. Again, we are here to help. And if you have any questions, first, what we can do is just sit down or do a phone call and say, hey, answer what we actually do within chiropractic. How can we help? What do we need as far as, is it a referral or is it something that we can help out with, and really be able to bring everything together for you, hit your goals, and not just hit them, but hopefully exceed them too, and really be able to create a healthy pregnancy and then life going forward from there then too, right? Because it's so often we're thinking about, like, I think of pregnancy being a marathon in itself. Labor and delivery is kind of its own marathon. Maybe it's a sprint too, but it's its own marathon. And then we kind of just say, okay, we're good. And then there's a postpartum part as well of taking care of yourself and taking care of your baby. So we are here to help. Reach out if you have any questions. Thank you for your time. And we are grateful to be able to serve you, and let us know how we can help. Thank you.